Welcome to Clear Answers About Clear Vision, the exclusive podcast series by Vance Thompson Vision. Our goal is to empower you with the knowledge and insights to make informed decisions about your eye care. Whether you're exploring options for vision correction, cataract surgery, myopia control, or oculoplastics, we're here to guide you. This podcast is dedicated to helping you achieve clear vision, one episode at a time.
All right, the day is here, you're getting LASIK. So what does that actually look like? So you're gonna come in, and the first little bit will be on the clinic side where we may recheck some measurements. We don't always do that, but sometimes we'll recheck the measurements for the laser. The other thing that we might do is, if this is see and do LASIK, meaning this is your first time with Vance Thompson Vision, we're going to get our first measurements and get some images of the eye and everything. We do not dilate eyes on the day of LASIK. We can't do that. The laser actually tracks your pupil. And so, fun fact, we don't dilate your eyes on the day of LASIK. After that, you'll come over to one of our pre-op laser suites and meet with someone on the laser team. That's where we're gonna make sure that the process is laid out, any sort of paperwork is signed, and all of that stuff's taken care of. And then you usually get a little bit of relaxing medicine. Now, it's important during LASIK that you are awake and aware of what's going on. You cannot be put to sleep for LASIK because it's actually important you're focusing on a little light, and we'll talk about that in a second. So you get a little bit of a relaxing medicine just to take the edge off a bit, and then we let that kick in, and then you come into one of our LASIK suites. So in the LASIK suite, we have a comfortable bed where you lay down on. The bed itself kind of moves between different lasers. LASIK is generally a 2-laser procedure. So once you're laying down, we clean the eye off to sterilize everything to decrease the risk of infection, and then the surgeon comes in. The surgeon will kind of review all of the plans, make sure everything looks good, and give the final stamp of approval. And then we start the actual procedure. So what is LASIK like? How long does it take? You're laying down for about 10 minutes. And like I was saying, it's a 2-laser procedure. So the first laser is how we create a flap. We use something called a femtosecond laser to create a LASIK flap. Now, if you think of your cornea, that clear dome that you look through, that's where we do LASIK. If you think of that, that's about 5 pieces of paper thick. So about 550 microns, so 5.5 pieces of paper. And the flap is about 100 microns thick. So about 1 piece of paper, that's how thin that flap is. Now, we use the femtosecond laser to create this flap. What you experience during that, you can't feel the flap being made, but we hold your eye still with a little suction. And so you feel that little suction on the eye. The eye's numbed, so you experience that as a little bit of pressure, and the lights may or may not be a little dim. And that's the most uncomfortable part of the procedure, very tolerable. And then we do that on the right eye, we do that on the left eye, and that's how we create the flaps. Now, when we're making the flaps, it's actually kind of like laying down little perforations in a perforated piece of paper. If we never lift that flap up, it's kind of like nothing ever happened. So the next step is the bed moves over to the second laser, and this is an excimer laser that actually ablates tissue and changes the shape of the cornea. So what we're doing with LASIK is changing the shape of your cornea, making it flatter or artificially steepening the cornea to get rid of nearsightedness and farsightedness. We can also get rid of astigmatism. So we get you underneath that laser, we put a little eyelid holder in, and then we lift that flap up. So once the flap's lifted up, we'll have you look at a little green light usually. It's a little green or a little orange light. And really important to know at this stage, the laser is tracking every single little movement of your eye. And so it can track the movement of your eye and fire accordingly, and actually stop firing altogether if it feels like your eye has moved too much. And so this is a really safe part, but a part that we need a little bit of cooperation as you're looking forward at this little green or orange light. Then usually normal LASIK, the actual excimer laser takes about 5 to 15 seconds. So that's it. And then I say the eye's going to get a little bit of a bath as we use a bunch of fluid to get that flap put perfectly back into place. We do that all on the right eye, and then we do it on the left eye. you get some medicine drops, and then you are done with the actual procedure. That all takes about 10 minutes total to get both eyes done. You're gonna sit up. Things aren't gonna be crystal clear when you sit up. I usually tell folks, hey, this is gonna feel like you got something under a contact lens, or almost like you're looking underwater for a little bit. You're gonna feel good enough where you can walk to the car at least and get around, but it usually takes a few hours for that to clear up. So I usually tell folks, give it about 3 to 4 hours. The eyes are gonna feel a little stingy, almost like you gotta drop a Tabasco sauce in there. And then they're also gonna be a little blurry, but at that 3 to 4 hour mark, that's when things really start to pop. You're using artificial tears and the medicine drops. And for LASIK, most people wake up the next day and things are feeling really good and they're seeing really good. And then the only other thing, for healing, the important things: 1, no rubbing; 2, use those medicine drops that we give you; 3, artificial tears; and 4, no rubbing. So that's how you're really going to help make sure that everything that we do in those 10 minutes serves you well, for a long time. So that's LASIK, the day of LASIK in a nutshell.
The next morning after LASIK surgery is one of our favorite times to see patients, because most people will wake up that morning and go, okay, I can finally see things. And they haven't seen sometimes since 3rd or 4th grade, and now all of a sudden they can see all the way across the room. So it's a fun time. It's a big wow factor for patients the morning after surgery. And so that right before they come in for that 1-day post-op visit, it's one of our favorite times to hear all the things that they can now see that they couldn't see before. That 1-day visit, we're doing a couple things. Number 1, we want to check the vision, make sure we're on track with where we should be vision-wise and what our targets are. Second, we want to make sure that everything's healing fine, that you're on the right track as far as the healing is concerned. It gives us also a chance to go over with you or review the instructions, how to use your drops, kind of what to expect as the eyes continue to heal over the next week and month. First of all, we want you to be real protective of the eye. I tell people for the first couple of weeks you want to be real protective of the eye so it doesn't get bumped or poked or hit. So real protective of it. After a couple of weeks you can be a little bit not as protective of it. But I still, when I had my LASIK done, I was really careful for probably the first 2 or 3 months. And then after that I slacked off a little bit. So being protective of it more than anything. Number 2, follow the instructions. Take your drops as prescribed. You're on some drops for a couple weeks afterwards to help protect against infection, inflammation, and all those instructions that we printed out, it's easy to follow. And then third, you cannot use the lubricating drops too much. The more you use the lubricating drops and keep the eye really well hydrated during that initial healing time, the better you're going to heal and the better your vision's going to be too. Usually most people are able to go back to work within a day or 2 after their LASIK surgery. Some people go back the very next day. Most people get up that morning and feel very comfortable with their vision to the point where they can drive. But some people, the vision is still a little bit fuzzy. Some people who have certain higher corrections may still be a little fuzzy on that first morning. They're going to continue to improve over the next few days and over the next weeks or so, but they may feel a little bit uncomfortable. So I would plan to have somebody to drive you just in case you're uncomfortable. But for most people, they're going to wake up the next morning and feel comfortable driving and probably even going back to work as well. So the whole key for that first day follow-up is, number 1, we want to celebrate your vision with you. We want to celebrate that you're now able to be corrected without your glasses or your contact lenses. Second, we want to ensure that the healing and your targets and everything are on the right track for you at the very beginning. And then third, to answer any questions that you have about your instructions or your expectations and where you're going to be going in the next week to month as your eye continues to heal. But it ends up being more of a celebration of what was kind of anxiety provoking to begin with of having LASIK, and now all of a sudden you're able to see and really celebrate it with you.
Some common expectations after about a week after surgery is most people are feeling really excited about their vision. Vision's maybe not perfect yet, because it can sometimes take for some people even a few weeks up to a couple months to have 100% of their vision back. But at a week, people are feeling really good about their vision. They can sometimes have a little bit of foreign body sensation. For example, you might even have almost a dirty contact lens feel on and off for the first week or 2. But that's very minimal, and most of the time that's due to some dryness, and some artificial tears can really help out with that. A lot of times after LASIK eye surgery, people can get a temporary dry eye. And most of that's due to healing and inflammation in the eye after surgery. And so using some artificial tears can really be a person's best friend for the first few months after surgery. Now there's also other options like punctal plugs, or even prescription eye drops, or even thermal pulsation procedures that we can do for a person's eyelid to get their glands pumping. But a lot of times artificial tears can be a real simple way to get somebody through the healing process. Most of the time at the 1 week check-in, a person's coming in and we're just checking their vision. That's the exciting part. We can see people a lot of times seeing in that 20/20 range. We do a visual examination of their corneal flap. So we look at their flap with a microscope and make sure they're healing. These are usually pretty straightforward, pretty easy exams for us. And it's just a fun time to catch up with a patient and just make sure that all their questions and expectations are being met. Even at 1 week, even though you're doing well, the eye can still heal for at least a month up to surgery. And that's microscopic healing. Most of the time it's not something that people necessarily feel or we even see, but it can still just cause us some little fluctuations in our vision and intermittent feelings of foreign body sensation, but just very microscopic type of healing. If somebody's not seeing, perfect after a couple weeks, most of the time that continues to get better. It's rare, but sometimes somebody can even heal for 3 to 6 months. On very few occasions, if somebody's healed at 6 months and their vision's still not perfect, the nice thing is we can always go back in and do a fine-tune or a revision with more LASIK and make it even better.
Thank you for listening to Clear Answers About Clear Vision, the exclusive podcast by Vance Thompson Vision. We hope this episode has empowered you to take the next step toward achieving clear vision. If you found this information helpful, please share it with a friend who might benefit too. Ready to take the next step? Schedule an evaluation with our expert team or visit us online at vancethompsonvision.com to learn more. Together, we'll help you see the world more clearly, one decision at a time. Until next time, take care and keep your vision worth seeing.